name is Ruth Dapaah-Afriyie. I'm originally from Ghana, West Africa, and I came to this country in 1995 because to join my husband, who was then a resident at Brown University, medical resident. I chose to go to URI because they were well acclaimed for their pharmacy program, and that's where I wanted to do my postgraduate studies in pharmacy. I graduated in 1991 from the University of Science and Technology in Ghana, West Africa. It's now called Kwame Nkrumah University of Science and Technology, named for our first president of the Republic of Ghana, Dr. Kwame Nkrumah. And I majored in pharmaceutical chemistry for my undergrad. When I came to URI, I started with medicinal chemistry, which I thought was similar to what I did back in Ghana in 1990. I worked on a project with one of my professors and my mentor, Dr. Fiagbe, and we isolated one of the chemicals used for the treatment of falciparum malaria, artesunate, which is one of the leading medications for malaria now. So I was looking to continue with that aspect of pharmacy, but I realized it wasn't the same. So I chose to go to my first and foremost love, which is patient care. So I transferred to pharmacy practice in 1996, 97, and I joined the class of Professor Brett Ferret. So he's actually my classmate, Anita Jackson, Shannon Levesque, Jane Palchaskas were in the same class. I graduated from the Doctor of Pharmacy program in 1999. I was given credits for my prior experience and working experience. So I graduated earlier than the class in January. I had to do just, I think, 3 rotations or so. So I got licensed as a pharmacist in Rhode Island in 1999, February 1999. I decided to take a break from learning. As a mature student, I had 2 children. One was 5 years old, and I had one in 97 who was just a few years old. Now I'm confused. It's been so long, Erin, I can't keep track. And I started working with Brooks. I chose Brooks Pharmacy because it was family friendly, and my goal was to be there first and foremost for my children. I'm the youngest of 6, and I had the joy of being home with my mom, who taught me to do so many things. So I wanted to give my kids the same privilege. And I worked just 2 days with Brooks and every other weekend, which was good enough. So in 2009 or so, Dr. Hume sent me a message at home that she had a grant to start incorporating pharmacists into physician office practice. And they at that time had a relation. When I say they, I mean URI professors. Some of them were based on Rhode Island Hospital campus, and I decided to pursue that because another interest of mine was in teaching. And I came here, Rhode Island Hospital in 2000, I think 2000, Erin. And we started this physician-pharmacist collaboration in the primary care center of Rhode Island Hospital. At that time, physicians here had not been exposed to pharmacists working closely with them in the outpatient setting. But within a few months, we're able to get integrated in the team by putting ourselves out there, sharing information, going through chats. We used paper chats at that time, looking for patients with polypharmacy, patients with other pharmacy-related issues that we could intervene for the good of the patient and also help the physicians provide the best care. And we also did some in-service teaching. I had 3 API students with me at that time, and we did very well. They accepted us and formed a very good relationship. But I realized that I was being taken away from my primary goal of being with my children, because now I was working 5 days instead of 2 days. So at the end of 2001, I told Dr. Hume I could not continue. And then I just went back to working with my Brooks. Fast forward 2009, my oldest was in high school, upperclassman, and he could drive his little brother and sister to school at LaSalle Academy. So I decided to come back to hospital practice, and I started as an inpatient pharmacist. But then when I came back, the director of pharmacy at that time, who is now our Vice P, Christine Collins, mentioned that she wanted to expand services in the primary care clinic to 5 days. When I left, they had bothered her to put someone in there, and there was someone working on Friday mornings, only 4 hours a day. So I jumped in and led a team of 2 other pharmacists to continue and expand to providing diabetes education. We got certified, the 3 of us, in cardiovascular and diabetes education with the state of Rhode Island in 2010. And we had a physician champion who was very interested in the well-being of patients with diabetes. So in 2010, we started offering group diabetes education classes. We expanded our individual sessions to include more patients on our schedule. So in 2011, I started thinking about getting board certified in ambulatory care. I did not go into a residency because, as I mentioned, my primary commitment was to my children, and I would have loved to, but I had such a broad experience from practicing in Ghana. I had worked at a university hospital for my internship, and I had transitioned to a large academic institution with about 1,800 beds from pediatrics to geriatrics, and I had moved into a community setting with a practice like one of those clinics we have here, ambulatory care clinics. So I felt this was what I wanted to do for the long-term goal. So I stayed on with the primary care center, got board certified, started an ambulatory care residency program, and we were fortunate enough to move to a bigger site where we could have specialties, medical specialties like rheumatology, GI, endocrine, all in the same building. And gradually we started increasing. In addition to my residency program, which I started with my first resident in 2013 to 2014 with 1, we've now expanded to 3 residents. And I've still been in touch with Dr. Hume, who's my mentor. And one thing that really impressed me when I came to URI was that though I was a foreign graduate, put it that way, when I went through the program, I was awarded the Best in or Excellence in Clinical Practice Award the year I graduated. And I felt that was an honor to me and my institution, my alma mater in Ghana, and also URI. And I've always had the heart to give back. So I still go back since 2017. I've been going back to Ghana to teach twice a year for their Pharm.D program. I'm an associate professor there. And this year I did it by Zoom, and it went very well. Last year, sorry, because of COVID. So what else do I have to say? It's been a long journey from building the practice of ambulatory care at Lifespan Institution. I started with Rhode Island, just 4 hours when I came back. We've expanded to 32 practices, different physician practices. We started with just 2 my other colleagues, Eridania and Kathleen. Now we have 22 full-time pharmacists working in the ambulatory care setting. We have clinics, or we collaborate with not just primary care physicians. We have rheumatology, pharmacists in the rheumatology clinic, GI, endocrine, cardiac rehab, at different sites, not just at Rhode Island, but at the Miriam, at Newport, and private physician offices, part of the Lifespan Accountable Care Organization. And I owe these successes to my mentors and to the schools that I attended, URI and Kwame Nkrumah University of Science and Technology. And one key thing I know is that we cannot be who we are without looking to others. I'm a big advocate for mentoring and mentorship. And what else can I say? But thank you to all my professors at URI, Dr. Larre, the dean, he's been to Ghana. And I'm just very grateful.
Yeah.
Very, very grateful. It's been a long journey. Yeah. And I also believe in succession planning, such that when I had been the residency program director for 6 years and I saw the potential in my second resident who stayed on with us, we've had almost every resident stay on with us, and that tells how our program or our services are expanding. And I worked with her closely, transitioned the directorship of the residency program to her so that I could get more involved with other things at the state and national level. I'm a practitioner surveyor for ASHP residency programs, been doing that for the past 5 years, almost 6 years. And I'm also a member of the Vision Practice Advancement Committee. And I'm glad to say that I was one of the first participants, or the participants of the first Ambulatory Care Summit. I'm also a member of ACCP, ASHP, RISHP, RIPA. So in a nutshell, it takes hard work, commitment, having a vision, and having a goal. And my personal leadership vision or mission is to lead my team with integrity and help everyone achieve their highest potential, both professionally and individually, and to hold high the banner of pharmacy. We have a big role to play in our healthcare. Even with the pandemic, I was here with my physicians, and because of the relationship we had developed, we saw the need to help our community here in getting a test center. It wasn't easy, but we're able to get together, collaborate with the state, find out where we needed resources, and fortunately, the National Guard stepped in to provide the necessary setup so that we could help our patients who come from diverse backgrounds from all over the world continents, those who can pay, those who can. It's just a broad socioeconomic stratum, and we've been able to help with that. And I still continue to deliver health with care and excellence to my patients.
Yeah, that's amazing. It sounds like you've done it all, basically. you've done a lot in your career, and I commend you for that. So thank you for sharing all of that. So what do you feel like is the most rewarding part of your job?
The most rewarding part of my job is to see patients achieve their desired outcomes, health outcomes, and to see those who came in with no hope, like absolutely no hope in getting their lives back together. I'm also in the addiction medicine clinic. And once we help them get their health, get their things on track, knowing that we'll always be here for them, non-judging, and help them along, that's what brings me joy. And another area in which I find most joy is when I see my students, former residents, accomplish their professional goals and go ahead in their career.
Yeah, that's definitely rewarding, I'm sure. So you talked about this a little bit, but how do you feel like URI in particular prepared you for the role that you're currently in?
I would say that even for Dr. Hume, recognizing that I had that potential, I knew I could do it, but URI prepared me with the clinical expertise, exposed me to various practices during my API rotations. I happened to do one rotation at Coastal Medical, and the professor there, Kathleen, she was also a URI professor. And just them pouring into my life the knowledge that they had acquired helped me go along this path.
Yeah, I feel like the professors at URI do a great job of, you know, helping us along and really believing in us. So I definitely agree with you on that one.
Yeah. And even for Dr. Hume reaching out to me when I was at home, graduated, knowing that I could do it, that faith in me helped me to do whatever. And I wasn't left to myself. I could always reach out to her, and she was willing to help and is still willing to be there for me.
Yeah, it's amazing to know that we have those connections from URI. So you answered everything that I wanted to know. Was there anything that you didn't cover? I didn't ask. Anything that you wanted to share in addition?
I would say that with URI, we are Lifespan, major provider of happy experiences, and we have such a wide range of practices, pharmacy practice. It's not just hospital practice alone. And I would encourage them to explore and find where they have their best interest or passion, because I don't see myself coming to work every day. It's just part of my life. And I just come in, I don't separate, I do balance my work and my life, but it's not like, oh, I have to go to work today. I'm like, yeah, I get to go to work today. That's because I'm doing what I love to do, and I've been equipped with the skills I need to do. And I know that I have the support to do what I need to do. So I'll encourage incoming students that this is a great place to be, a great place to grow, and a great place to find your passion.
Absolutely. I agree 100%. So that was all I had prepared. Thank you so much again for doing this with me.
You're welcome.